As we age, we get a thinning of the skin of the neck, just like we do in other parts of the body, with a loss of collagen fibers and a loss of elastin fibers. And this happens as part of the aging process because of reductions in hormones as we age and because of exogenous effects such as sun damage and the use of alcohol-based perfumes on the neck. This can result in dull, marked skin that's lost a lot of its elasticity and is hanging off there, and it's what we would refer to as an aging neck or sometimes as a turkey neck. The options for rejuvenating the skin on the neck involve things that can be done to actually improve the quality of the skin itself, things that can be put underneath there to add volume underneath there, and procedures that can be used to actually tighten up the skin itself. When it comes to improving the quality of the skin, simple things like wearing sunscreen on a day-to-day basis are very important. That stops further solar damage. Good quality products with vitamin A and vitamin C can be useful. And then we move on to the more energy-based systems such as laser systems, which can help to cause the body to rejuvenate the skin of the neck, thicken it up, produce more collagen and elastin fibers. We can also use platelet-rich plasma, which is blood plasma that's been prepared that has a high concentration of platelets, and this can be injected into the neck to once again stimulate the production of collagen and elastin fibers and tighten and rejuvenate the skin. There are other procedures such as Ulthera, which uses ultrasound to cause a heating of the skin, the tissue underneath the skin of the neck, and can tighten that skin and rebond it to the underlying tissues. Platelet-rich plasma, or PRP, is blood that's been prepared in a way to extract the red blood cells and concentrate the platelets somewhere between about 2- and 5-fold. Platelets are little sticky cells in the blood that are involved in wound healing, and when the body is injured, the blood clots at that site and the platelets get stuck in the blood clot. And what we now know is that the platelets then release growth factors, and that these growth factors cause other stem cells to be attracted to the area, then differentiate into collagen producing cells, blood vessel producing cells, and skin producing cells, and then upregulate and start to heal the wound. So platelets are the cells that initiate and govern the wound healing process, and they're now used in many areas of medicine. Cosmetically or aesthetically, we can use them to rebuild and boost the skin by thickening up and improving the production of collagen and elastin fibers. The aging skin on neck, as we age, once again, there's a thinning of the skin and a loss of collagen and elastin producing cells. The stem cells, or the cells, the fibroblasts that are there, get down regulated over time and just start to get sluggish and don't produce as much collagen and elastin. The platelet-rich plasma contains high levels of growth factors, which is the body's own natural healing mechanisms to initiate that. So we inject those into the cells of the neck. These then stimulate the dormant fibroblasts to come back to life, to upregulate and start producing more collagen and elastin fibers. So we're using the body's own wound healing mechanisms to heal the wounds of time that have been inflicted on the skin of the neck and the face. Because the skin of the neck is very thin, we're trying to get the PRP into the skin and not under the skin, we'll use an injecting device. This device has a vacuum which pulls the skin up to the needle cartridge and splints it tight. The needles then go in approximately 1.5 millimeters and inject very small amounts of PRP. We'll repeat this procedure over the entire neck so that we've evenly distributed approximately 5 mils of platelet-rich plasma via about 1,000 injection sites over about 500 injection sites on either side of the neck. The platelets will then lodge in the skin, release their growth factors, which then over time will cause that skin to thicken up and improve in texture and quality and tightness. The same with the decolletage. Because there's very little subcutaneous fat in these areas, we're injecting the PRP into the actual skin itself, and as the skin is quite thin here, it's very difficult to do that manually with a syringe. Most of the time your needle will end up underneath the skin. So once again, we will use an injecting device to do that, which enables us to inject the PRP evenly over a surface on the neck. To treat the neck, we would use 2 tubes of RegenLab PRP, and to have a treatment like that would be $750 to have that treatment with it injected over the neck and decolletage.